Well, hello. This is Dr. Amig, your host of the Unabridged MD podcast and YouTube video. And today I am so excited to present to you Rachel Lando, who is a patient with scleroderma and has also created a yoga program that we're going to go into a lot more depth. Uh, and before we start, just remember that if you are looking for a rheumatologist in the Colorado area, I have created the first direct care practice in rheumatology. And so you do not need insurance and you can just come and check and be evaluated by me. And we have packages that I think are really offering a ton of values. And so if you are interested, we are currently accepting new patients. All right. So without further ado, Rachel, so I think I need to share the story of how I got to know you. So this is a big shout out to Dr. Patty George, who we have had on the podcast twice now. Uh, and she is a pulmonary hypertension specialist, and she saw you recently, and she told me, oh my goodness, you've got to have Rachel on your podcast. She's absolutely awesome. She does yoga with her patients with scleroderma, huge advocate for scleroderma. And I was like, absolutely, I want this. And I think you have so much to share with our patients. So, Rachel, thank you so much for being here. And can you tell us about you? Like, you have a long story. We want to learn about your story.
Well, Isabel, thank you so much for having me on. I really appreciate the time and just getting to know you a little bit. So thank you. So my story. I was diagnosed with scleroderma in 2012. I was diagnosed in Utah by Dr. Tracy Freck, who is wonderful, and at Vanderbilt. And it was a pretty clear diagnosis, although it did take about 4 months from initial flare up until actual diagnosis. I woke up one day, it was like May of 2012. It was warm outside in the mountains, but my fingers had turned black. They were puffy. I went to the ER. I was diagnosed with sausage fingers and sent home. I was told, yeah, we don't know what this is. Go home. If it persists, come back. Well, a month went by, 2 months went by, it stayed. So I started visiting lots of specialists, from infectious disease to dermatology. I mean, I probably know all the doctors at my local hospital just from having met them then. And eventually somebody saw me and suggested that I consult with a rheumatologist. As soon as I had my irregular ANA, they ran another panel, and it was easy to diagnose me because I did have anti-SEL70 present. So it was a quick diagnosis. Systemic scleroderma, diffuse, sometimes you hear it as diffuse. And then after that, it was kind of a wild ride because I had a quick onset after that initial major flare. Immediately, I started declining in health. I lost about 45 pounds. It was really hard. It was really hard to find help because I was deteriorating so quickly. But luckily, I had a great doctor and I was able to make it through that initial period. So if there's any patients listening, like, have hope, because sometimes those first flare-ups are devastating, but you get through them. Anyhow, after about 5 months, I was having these persistent episodes of psychosis. I was put into a medically induced coma. And when I woke up, my hands were completely contractured. And it kind of looked like I had scleroderma, like those characteristic features of tiny mouth or mouse cough. And yeah, it was pretty scary. I also had brain inflammation, pericarditis, fatigue, muscle atrophy, just anything that could go wrong did. I woke up at that time with osteomyelitis or bone infection, if for patients. And And that was hard to manage. I ended up spending about 2 years trying hyperbaric oxygen treatments and just alternative techniques to try to treat that. But I was 28 at that time. I went from being a perfectly healthy, normal person to being a 90-pound, weak, really foggy-minded human being. And this was very new to me. I'm lucky enough to have received a good education, and it was really hard to manage. It was just really hard to manage because I could no longer walk. I could no longer take care of myself. My hands had curled, and I suddenly had this new thing to do every day, which at that time I was in a study for tocilizumab, which is now approved. But I had to do these shots, these subcutaneous shots, and so doing it with my new hands, it was a lot to learn. But ultimately, like I said, I made it through that period. And then after that, it did slowly start to slow down. So I went from this rapid onset to more of a gradual progression that involved developing some pulmonary fibrosis. I still have that mild, butterfly, mild basically mild fibrosis, or ground glass. Sometimes patients will hear it called. And yeah, from there, I just started coasting for a while. About 4 years went by. I had a daughter in that time. I got married in that time. All after diagnosis, I had a baby with a high risk, under the guidance of a high risk OBGYN. And then a year and a half after she was born, my GI started to become symptomatic. So I was struggling a lot with immotility. I ended up getting a total colectomy. One day I was on CellCept, so they couldn't repair the large intestine, and I lost the whole thing. The whole thing came out with an emergency surgery, air flight, all that whole jazz, all of it. It was pretty crazy. And I woke up in the hospital, and that had actually been my second time being intubated. I had been intubated with a brain inflammation back in 2012, and then this was 2017. And I remember waking up intubated, and I thought, I never want this to happen again. Not that it's under my control, it's not, but I never want this to happen again. And so I'm going to do everything in my power to make sure that it doesn't. And it was after that second surgery that I started developing a stronger interest in breath practices. I was already practicing yoga, but I started taking it a lot more seriously. And I also started noticing at that time how weak, even though, as I've mentioned, I'm an educated person, how weak my education actually was around my own health. And so right after that, I went back and took some more college courses. I hadn't taken anatomy and physiology in about 10 years, so I took that again. I started taking more advanced medical courses. I'm lucky that I had been pre-med in undergrad, although I didn't pursue that. So I already had somewhat of a science background, but I ended up starting to really study research. And that was when I started to realize that patients really didn't understand what was happening to them at all. And if patients don't understand what's happening to them, how can they manage their cases, even with the help of a doctor? How can they manage their day-to-day lives? And so this is when I started developing educational material. This is when I started kind of rethinking what it meant to be a patient advocate. This is when I went back to yoga teacher training and did all of that. It was all right after this major event that had taken me down. The other thing that was interesting is when I developed, after I had the total colectomy and became a forever ileostomy patient, they told me I couldn't do any core training, and I didn't know I didn't know what I was going to do. Being that my hands are so dramatically contractured, my core is everything. That's how I move. And so I was very scared. And again, I had to develop a new education about that as well. The other thing I didn't mention is after I got diagnosed, I was the support group leader in Utah. So I also was simultaneously trying to help other patients manage their condition and manage my own. Um, and so, yeah, that's kind of my story. I mean, it all changed in 2017. Since then, I've been completely stable. I actually had my PFTs and met up with my pulmonologist just the other day, and I have not changed since
Mhm.
2017. So I'm super excited about that.
Yeah.
Yeah.
Well, so thank you. There's so much. There's so much here that you've told us. So there's a couple of things that I want to make sure we share with the people who are listening to us. Is that you got diagnosed more than 10 years ago, and that in those 10 years, as you mentioned, there is more treatment that have come up. There's also now transplant that we can do in very severe cases, and so I think this is really important to realize that. For my patient, for the patients that just got potentially diagnosed with this, is that number one, you have a very severe, like it was severe. The presentation was very severe, so that's number one, because we don't see all patients with scleroderma with as severe as you developed, right? Like the inflammation of the brain is something that's really quite rare. So that's number one. Number two is that there are a lot more treatments now than there were in 2012, that there is a lot more knowledge about what scleroderma is now than there was in 2012. And then the third piece that I really want to discuss with you is this mind shift that you did, right? Like, so first of all, I just want to thank you from the bottom of my heart to be an advocate for other patients, but also for the whole community of scleroderma, which comprise rheumatologists and so on. Um, it is a chronic condition. As you mentioned, it comes in flares. You don't really know where you're going to be right away. You went through hell. You went through hell. It's not a. I want to say, like, I used to see this patients hospitalized with severe scleroderma a long time ago, and because I did two training, one in France and one in the US, and I have to say I feel like there's less and less patients that are hospitalized due to scleroderma because we have learned a lot more about it. Um, so thanks to people like you who are able to, that are empowering patients so that they are not afraid and are deciding that I don't want to see a rheumatologist, but rather, hey, let me work with a rheumatologist. So first of all, yeah, thank you for sharing your story. And then now let's talk about the mind shift that happened to you, because and you may not know my story, but like I myself had breast cancer, so stage 4. And so I also realized that there was a lot that I didn't know. And that there's a lot that you learn in medicine. And I think that I'm a huge proponent of what, evidence-based medicine. And I think that there's so much now, it's so powerful. Our treatments are amazing, and in rheumatology particularly. But there's so much that we each can do to, improve our healing. And so I'd like to hear what you started doing, because you started talking about breathing, about yoga. What have you done? And
So
what do you do?
yes, I do so many things. Oh my God. But right before my large intestine issue happened, I had already, being that I was a parent, I was noticing, and I wonder if other patients notice this as well. Yes, inflammation of the brain to the degree I had was rare, but I wonder sometimes if we live with systemic inflammation, what does that do to our mindset? Because I notice in working with patients, you can almost see the way their thoughts change during a flare up. So anyhow, I had noticed that in myself already. I had already noticed increased irritability. I was having trouble being a present mother. And I just didn't love, I'll just say it, I didn't love myself anymore as I was. The change that happened to my physical self was so dramatic. My face changed, my body changed, my thoughts changed. Like, it was such a huge transformation that I had already before that time started practicing meditation with a Buddhist mindfulness teacher. So I was doing this, and we were doing this in tandem with restorative yoga. And for those that don't know what restorative yoga is, that's a long held, supported position where you relax. So I had already started that practice, and I had seen some change. And it honestly felt so horrible when my large intestine failed, because I was like, no, I'm doing the work. Why is this happening? But it, like I said, it ended up being a tremendous opportunity to learn more. So after that, I actually started doing PT Pilates because I didn't feel comfortable. I was scared leaving the hospital about what could happen if I did too much core training, what could happen to the organs themselves. And I didn't know enough yet at that time. Now I know so much more, but I didn't know enough at that time to feel comfortable doing it on my own. So I worked with a PT. I did Pilates for about a year. And then I did the training in yoga. By that time, I was doing PT Pilates twice a week. I was going to 2 quote unquote regular yoga classes a week, like vinyasa style, which means movement. But I was fortunate enough to find a teacher who decided she was going to teach her vinyasa flows completely on a bolster. She will tell you she didn't do this for me, but she did do it for me. It's very obvious. Like, nobody else needed bolster hatha yoga. So I was lucky enough to find a teacher who actually supported me. I think that our support systems, our doctors, our PTs, our teachers, those relationships are super important to cultivate. Anyhow, so I did all that. And then after about 2 years, I didn't need as much help anymore, and I moved into my own practices. But I found I still needed more support. And so I started looking towards supportive practices. And I ended up stumbling across the work of a woman named Jill Miller. And Jill Miller's teachings, she has a brand new book out. I highly recommend it. It's called Body by Breath. And what she teaches is about the impact of the parasympathetic nervous system. And that essentially our body goes into a relaxation response. It helps our immune system function in a normal way. And once I started doing those practices involving self-myofascial release and parasympathetic breath practices, all of a sudden, my body started to change shape. I was no longer as tight. I was able to find more mobility, and I was actually able to find more freedom of mind again. And so I went from, I was in a PhD program. Like I went from reading all these books to not being able to read at all, like not be able to process information. My cognitive function was terrible, to again being able to comprehend information. And it was so exciting. I still actually do those practices, and now I'm a huge advocate for SMFR and anything that
What is SMFR? Sorry, can you explain this to the auditors?
Of course, SMFR is self-myofascial release. Now, I don't love that term because you can't actually release your myofascia. That's not a thing. It's a bad term, but you can certainly do practices to support our connective tissue. And doing those practices is how I actually started to learn more about the science of connective tissue and get into the research from sports medicine. Because even though this sounds kind of hippy dippy in a way, all of the practices that I teach are also evidence-based practices. I don't like to teach things I don't understand, like things where there's no data. So anyhow, SMFR, you take soft tissue tools and you roll them into your skin. It's very relieving. And you can target certain areas to stimulate certain responses, like physiological responses. For instance, one that my teacher talks about a lot, and I've researched quite a bit at this point, is how we can, and this is also very popular, and you do see it in like pop fitness culture, but that doesn't mean it's wrong. It's just trendy right now. The vagal nerve stimulation, where if we palpate our face or our supradiaphragmatic area or those organ regions right below, like visceral massage, that too can stimulate a parasympathetic response, like a physiological response. And that physiological response is really supportive. So anyhow, I integrate that with movement, with parasympathetic breath techniques. And a lot of my work is based off what I've learned from Jill Miller, but it's also a combination of things I've learned in PT Pilates, from PTs in general, and then chair yoga as well. So I just kind of combine all of my favorite modalities into something that's relaxing and supportive, but still invigorating and fun, because we have to, if we really want to touch people, like affect people, we do need to meet them where they are. And I think where most patients are is in a place in which they do still need support.
Mm-hmm.
And it's hard. Yeah.
So this is really interesting. So first of all, I commend you for sharing all this, because that's exactly what I'm sharing with my patients. And that's literally what I did myself for my own healing, and I continue to do. There's a couple of things that the point that I wanted to go back to. So number one, yes, the parasympathetic system is the system that's the opposite of the adrenergic system, which is going to be the flight or fight. And so for the auditors, we talked about this in the past, but basically, you're not going to heal your body if you're in a flight or fight mode, because that's not the goal of the flight or fight mode. That goal is to, either go away or fight. And so the body is not healing. At that point, it's not healing. The parasympathetic system is the opposite of that. And that's really when you're healing your body. You're really like trying to heal. And that is why you're feeling good after doing meditation, after doing breathing exercises, etc. There are some devices that are being evaluated currently for rheumatoid arthritis. I'm sure it would happen for scleroderma as well, where they stimulate your vagal nerve. I think it's in the neck, because it's been proven to actually work for epilepsy and some other conditions. So this is super interesting. But the thing I want to ask you, and it's not evidence-based, it's really just your own experience. You had two major flare. The first one that got you like inflammation of your brain. It was a long time ago, so I don't know how you were treated. I'm not your rheumatologist. But then you had this second flare when things seemed that like it was going okay. And then you said, okay, done. I don't want to have another flare. I'm going to do everything in my power to make sure that I don't have another flare. I'm assuming you didn't stop your medication. Is that correct? You continued your medication.
No, I actually, I did continue my medication, but I don't actually talk about this very often, because I would never, never, never tell another patient not to stay on their medication. I actually did go off, other than my antidepressant, I still take sertraline, but other than sertraline, and I take that, I don't think that I am producing as much serotonin without the large intestine. So it's not something there's nothing I can't make that reaction happen. So I take that, but I did go off all my medication.
Yeah. This is so powerful. So this is super, super, super important for my patients and for everyone that's listening right now that's not a patient, right? There is a role of Western medicine. There's zero question that when you're in the hospital, I mean, I'm looking at you right now and I'm like, man, I mean, if we were like, I'm not your doc, right? But my approach is you put off a fire with a ton of water. And so immunosuppression, and then you back off. That's my, that's sort of what I do. But the idea of a backing off is so important, because once you're perfect, and like when we hear you, Rachel, I mean, clearly you were severe and now you don't need all of those medication. And I mean, yes, we need to do studies on the parasympathetic system and all of the modalities that you're doing. But like, the risk is literally null of doing all of those technique, right? Doing meditation is not going to cost you any money, and it's not going to cost you any side effect. Like, there's no side effect of, I mean, you may fall asleep, right? Or you may get upset at yourself because it's not perfect, which, not recommended, but I know I still do that sometimes. So this is so fascinating to me, because I see it in my practice. I have a lot of my patients that, the moment I see them, I do have to give them immunosuppression, but then I tell them, hey, you need to do all of this work, those homework, in addition to taking your medication, and so we can back off. And so I'm really intrigued at, like, did you feel that you were feeling better with doing this work, with the breathing, with the exercise, and with, your mindset? You started seeing how you were healing?
Yes. So I can feel it. I've gotten very, I mean, now I've really done so much research into exactly what connective tissue is on a microscopic level. And it's really an environment of proteins, of cells, of non-Newtonian fluid. And I teach entire courses on this now. So I'll try to rein it in. But I can feel the proteins are thicker in scleroderma patients. So I can actually feel where I'm thick and when I'm not thick. The nerves, the free nerve endings are embedded in our connective tissue. That's their terminal ending. And so I can feel it, I can recognize it, and I can see it. I used to not be able to grab a hold of my arm skin, and now I can grab my arm skin. These are measurable markers, and I feel that we don't have a good way of measuring these now. It's because it's so relative. The pinch, how much is that going to show a Rodnan skin score? That's going to be completely subjective. One doctor might say one thing, one doctor might say another. We don't have a good standardization, but for myself, I can easily recognize it. And again, my mind gives me such a strong clue. When I'm able, when I'm happy, when I'm being a good mom, when my life seems to be going easy, it's almost as if my body is easy. What my perception is what allows me to perceive what's going on inside. My outer perception gives me clues to my inner perception. And so I could feel it. And the other reason I ended up going off my medications is I am one of those people who actually goes to cadaver labs. I like to go to a cadaver lab down in Colorado Springs. And I don't know, I was dissecting this one, we call them teachers. I was dissecting this one teacher, and I don't know, I felt like we were kindred or something. And I'm not, I mean, I'm not qualified to say why she died. I'm not, it wasn't an autopsy report. I'm not a coroner. But just looking at this woman, it was so evident that what had killed her was not her disease, but the course of treatment she was receiving. There was pulmonary hemorrhage. It was just so clear. And I started to question, are the risks worth this? Like, maybe I need to take a step back and see.
So I'm just going to interject just one, just to clarify. Number one, the Rodnan score that you mentioned is a score that we use for research purposes, but we use it also for follow-up to check the skin tightness of patients who have a scleroderma. So that's number one. Number two, I really want to share this with the community that's listening. Scleroderma gets better, and that's the issue with checking, like, when we are studying new medication, is that it does get better. The skin does get better. Uh, However, I think that a patient's intuition of how they are feeling is always to be taken into account. So if you feel this, I want to say, yeah, you're right, right? Like you feel it, you know your body a lot more. Um, and then I think the intuition that you may have had at that moment, to me, I always listen to this because at that moment you're like, hey, my risk, I feel that the risk of having medication right now, as I am right now, is higher than the risk of the condition itself. And that we have to listen, right? And that's the job of the rheumatologist, to basically look at how you're looking, look at your evolution, and then decide with you, because you always make the decision, right? Yes, I agree with you, or okay, I may not completely agree with you. And so then I'm going to just ask you to come a little bit earlier than what I would normally do. Right? You always give, you always do what the patient wants, of course. But, maybe you're like, instead of 6 months, I'm going to see you in a month or 2 months. um, but I think that that's really important for everyone to realize that Rachel was not like, it's not, you're not saying no to the medication at the beginning, right? Like, it's like, you're much better. You have techniques that you're doing to help you, and you know yourself a lot more as well, and you know your body a lot more as well. So I think that it's not a no medication or not. I just wanted to interject this because I don't think that what you're saying is that we should not have Western medicine. I think what you're saying is listen to your body, do all of those techniques, and maybe you won't need the medications. Am I correct?
Yes, absolutely. I fully support Western medication. I think it's very important. Like I mentioned, the sertraline. I can no longer produce like as much serotonin. I need to take a medication to help me. It's just we need to find that right balance for
Yes.
ourselves as an individual.
Yes.
So that's what I believe. I mean, I loved my rheumatologist. She was great, and she did teach me to listen to myself. And honestly, she did try to push immunosuppression on me earlier, because they were concerned about my pulmonary fibrosis. But my pulmonologist would tell you she recommends my program to her patients because I have stayed stable. And the other thing is when you look at the nitty gritty, when you look at the again, on a microscopic level, exercise can do so much because, for instance, vascular endothelial tissue becomes damaged in scleroderma. And for those that don't know, endothelial tissue is like the border tissue. It's like the barrier tissue. And it becomes damaged, we leak. My rheumatologist always said, well, scleroderma is really a vascular condition, which it is. Our blood vessels are affected. But we can change the outcome of our blood vessels simply with certain kinds of exercise. There's so much that we can do naturally that if you know what questions to ask your rheumatologist about what is happening to you specifically, there may be some things in our power that we can do to treat. Sometimes there's not. Sometimes it's end stage. There's just there's nothing in the same way. I don't have a large intestine. I can't do that. That's just the way it is. There is a degree of acceptance. There is a degree of loss and grief that every patient needs to go through because some things are no longer under our control. But why not use our natural healing power and really exploit its ability for self healing?
Yeah, I'm in full support of everything you're saying, and I think this is so important, is to empower our patients, to get empowered, and to empower for other doctors to empower our patients, because yes, there is evidence-based medicine and randomized controlled trial against placebo and double-blinded and so on, but like the fact that we can empower our patient to do things that they feel actually makes them better, that's huge. That's huge. I mean, I know for me, I did it. Like I did it when I had the stage 4 cancer, and I'm certain that it healed me. Scientifically, I'm not certain, but I know, at least from a mindset perspective, it saved my sanity because I have control. I'm gonna meditate. I'm gonna change my diet. I'm gonna exercise just for empowerment. This is the perfect time to ask you what your program is and where we can find you.
Okay, so I call my program Patient Care Movement. I have a virtual studio. Uh, it's www.patientcaremovement.org. And what I do is I offer these classes that are accessible no matter your stage of illness, meaning you can do them in a hospital bed, you can do them in a chair, you can do them on the floor. You don't need to have full mobility. I have worked with people um, whose aides have placed the balls for them because they don't even have the mobility to do it. So we start there. We start first with palpation. I layer in education. Like I use anatomical terminology to teach the patient population that sees me. And I explain to them that that is true empowerment, that if we start to understand our anatomy and physiology better, we can have more coherent conversations with our doctors. Because sorry, that was my dog. You often hear patients say, well, my doctor, this or that, like criticism of the doctors for not communicating the information. And my impression is that, of course, doctors are doing their due diligence and communicating the information, but somehow there's a language barrier. And so my goal is to help patients build their fluency in medical terminology. So I
Mhm.
teach them the science of connective tissue. I teach them the science of scleroderma or MS or Parkinson's, whatever disease they have. I do work with neuro clients as well. Um, and, and, and I've seen how much this changes patients' self-awareness, self-confidence, and ability to self-manage. And it's really miraculous. It's amazing. And then we also work on changing our mindset. So I do this more subtly. I ask people to set intentions, and I start gradually, as we get to know each other, almost correcting their language. Like, I'm trying to give a good example. Like, you know, I I am in so much pain. Like maybe it's, well, let's get curious about what that means. Are you in so much pain, or are you experiencing a lot of unfamiliar sensation? And sometimes when we approach our discomfort or our dis-ease with that level of curiosity, we start to realize it's not truly pain. And so I try to define pain for people as burning, stabbing, numbness, fireworks, and that everything else may not be pain, that may be your new reality. And we need to learn to live in our new reality and embrace it.
Mhm.
So anyhow, I still haven't told you what we do. It's a blend of Pilates, so core training, because most people with scleroderma in particular have weaker control, less activation, less nervous system. I'm trying to think of how to put it. A lot of patients live with neuropathy. They live with
Mhm.
nerve conditions, and they don't feel, like literally don't sense their periphery quite as well. So it's important that we do core training. I do what I call deep core training, which is training the pulmonary system, because we don't realize it, but all of those muscles that layer the inside of our thoracic cavity, of our rib basket, those need to be strengthened in scleroderma patients, because that can sometimes, even with pulmonary fibrosis, still allow for a better breath. Um, I teach everyone how to rebreathe. A lot of patients seem to breathe in their upper chest. Stress, it's common stress response. Um, and then we also generally target a couple muscles each time, and we sort of talk about them. So it's embodied anatomy, Pilates, yoga, breath, and self massage.
Okay, wonderful. Well, that's a lot, and definitely highly recommended for sure. I think that patients who have scleroderma definitely should look into going into a program like this. Anyone that has mixed connective tissue disorder, so the sharp, the sausage fingers, as you mentioned, if they have sausage fingers and Raynaud's phenomenon, I would highly recommend your program. In general, well, Rachel, thank you so much for being here. I mean, I think you are an inspiration because, as you mentioned, you could have given up, but you decided not to. You could have continued the course and then you decided that you were going to do something different. And once you found that thing different, you researched it and now you're sharing it with other patients. So, huge kudos to you. I'm so happy that you agreed to be on the podcast. So, thank you so much.
Oh, thank you
And
for having me. Oh, one thing I just want to interject is the other thing about my program is I try to make it affordable as well. So it's a lot lower cost than most other fitness programs,
yeah.
only because patients, 80% of patients live in lower socioeconomic classes. I'm
Mhm.
aware of that. I have lived that. Disability does not pay very much at all. So I want these things to be accessible, not only in spirit, but spirit and body, but also accessible financially.
Wonderful. That's wonderful. Serve and earn. I love it. Well, thank you so much again. So the it's Body by Breath. Sorry, the book that you recommended was Body by Breath, and your movement program is patientcaremovement.org. There will be all of those information in the comments of on our podcast and YouTube video. So again, thanks again, Rachel. And as for everyone else, have a wonderful week. We will see you next week. And if you are looking for a rheumatologist in the Denver/Colorado area, we are open for business at UnabridgedMD.com. Have a wonderful day, everyone. Bye bye.